Okay, there we go. Okay, so welcome again, everybody that has just joined us. And I'm turning it over now to Lorraine. And there you go, Lorraine.
Awesome. So good afternoon, right? Good afternoon, everyone. Again, my name is Lorraine Jondo. I'm a perinatal mental health coordinator at the Partnership for Maternal and Child Health of Northern New Jersey. And today we're going to be addressing perinatal mental health. We'll touch on identification, referral, and resources. Okay. So by the raise of hand, I am unable to see the chat right now. But by the raise of hand, how many of you are parents? I'm just trying to gauge the audience. Okay. All right. Let me see. If you are a seasoned parent, you know exactly. We're going to play just a little game, okay? I wish I can see the chat. Let me see how.
Can you, if you click on if you go all the way to the bottom, there should be the chat option. It
Yeah.
should open up.
I'm able to detach it now. Because when you're in a presenter mode, it's a
Oh,
little,
I see. I see. Okay.
yeah. Um, yeah. So I'm guessing that there are a few moms in the group, right? And I would like to play a game of Never Have I Ever. And let me start off with a fun little one. Never have I ever forgotten to eat as a new parent. And feel free to use the chat, use a reaction, raise your hand if you have.
Can you repeat the answer you gave? Never have I ever what?
Never have I ever forgotten to eat as a new parent. And if you have, you say I have. If you haven't, then you have not. All right. And never have I, you can use the chat because of the sake of time. Never have I ever Googled my kids' symptoms. Yes, I have as a new parent and as a veteran parent. Yup. Yes. Uh-huh. Um, Google is everybody's best friend when they are not sure of their kids' symptoms. Never have I ever stayed up to make sure my baby is breathing. Right. I see a lot of reaction. Nancy's like, yes, I have. Yeah. Because baby breathe weird, right? And it's anxiety inducing to to see them breathing in a weird pattern. Um, Never have I ever felt guilty for taking care of myself. I feel like every mother feels some guilt, some form of guilt for doing things for themselves. I still do. Yeah, right. Um, Never have I ever said I'm okay when I'm falling apart. Never have I ever said I'm okay when I'm falling apart. Mm-hmm. I feel like that's the automated answer. We all are quick to say, "Oh, I'm fine," when we really aren't doing well, right? It's like we were programmed to just say I'm fine every time things are falling apart. We all function under the narrative of I'm okay. Yes, that is true. But majority of us are not doing well, right? Is that mindset of who really like if I say I'm not well, do people really care? Well, I'm here to tell you that I care, right? So let's go in with today's presentation. So I have no first, before we go into the meat and the potato of today's presentation, I want to disclose that the planner doesn't have any conflict of interest to report for this activity. To receive continuing education, which we are not providing today, I'm gonna skip that part. When it comes to the certification and so forth, because we are not providing any contact hours, I'm just going to brush that off. So for those of you who don't know about the Partnership for Maternal and Child Health of Northern New Jersey is a nonprofit organization dedicated to improving the life of women, children, and families in Northern New Jersey. And we cover all the 8 Northern New Jersey counties. My program, specifically the Emotional Wellbeing Program, provides services to childbearing women, including those who have made an adoption plan, who have suffered a perinatal loss, and those who are have had voluntary or involuntary abortions. Okay. So the goal of today's presentation is to highlight the existing perinatal mental health care, also perinatal mental health care in the BIPOC community, emphasize the importance of screening and encourage relationship between patient and providers. So let's talk about legislation. New Jersey is one of the states where you have to, if you are in the care of a perinatal birthing person, you have to screen them for PPD, or perinatal mood anxiety disorder, specifically PPD, but we will talk about all the other mood and anxiety disorder that exist in the perinatal period. You have to screen, educate, the birthing person plus families about the signs, symptoms, coping, treatment of perinatal mood and anxiety disorders. So this is the statement from ACOG. It says it is recommended that all obstetrician, gynecologists, and other obstetric care provider complete a full assessment of mood and emotional well-being. If a patient is screened for depression and anxiety during pregnancy, additional screening should then occur during comprehensive postpartum visit. And to see the full statement, you can access it at the ACOG page, at the ACOG website. So here we are, and this is perinatal mood and anxiety disorder. How many of you guys know that perinatal mood and anxiety disorder is this broad?
Recording in progress.
How many of you know that? Yes, yeah, Molly said yes. Okay. Yeah. So oftentimes when we talk about perinatal mood and anxiety disorder, guess what? People only think of what? Which one? PPD, postpartum depression. Yes, postpartum depression is real, but it's not the only mood and anxiety disorder that happens during the perinatal period. During pregnancy and after birth, a mom can experience all of these. Baby blues is a common one, postpartum depression, anxiety, postpartum OCD, post-traumatic stress disorder, perinatal bipolar disorder, postpartum psychosis. And I'm going to go over each one of these to give you some understanding of each disorder. Is that okay? Are you with me? Awesome. So maternity blues, maternity and baby blues. How many of you know of maternity baby blues? Feel free to use the chat. Okay. Feel free to use the chat to let me know what you know about baby blues. But baby blues is a common yet a temporary experience that happen right after childbirth. Okay. And it consists of like sudden mood swings, feeling very happy and then very sad, cry for no apparent reason, and you wonder like, oh, what is happening with me? So this happens 3 to 5 days after delivery and usually resolve itself within 10 to 12 days postpartum. When this happens, usually parents are very concerned, right? Especially new parent, they are very concerned. They're like, oh, something is going on with me. What is happening? I'm crying for no apparent reason. I'm watching a commercial on TV. All of a sudden I started crying. I'm easily irritated. I was just happy and now I'm sad. I don't know what's happening. Yes, when you become pregnant, the body naturally and gradually builds the hormone needed, right, to cook this baby perfectly and house the baby. But once baby comes out, your body, the hormones suddenly drop, and that can cause some emotional turmoil, right? And that's what baby blues stems from. Baby blues is the body trying to readjust to the sudden drop of hormone. And it tends to go away on its own, right? Like 10 to 12 days postpartum, you should start feeling better, a little bit more like yourself. The sudden sadness may resolve itself. However, if you find yourself in that state past 2 weeks, then that is when we are concerned cooking the baby. Yes. um that is when it's a call for concern, right? Postpartum depression, that's when we are concerned for postpartum depression. And I'm sure many of you have heard of the term postpartum depression, postpartum depression. So use the chat. Let me know what your knowledge on postpartum depression. Just give me a brief some symptoms about postpartum depression. So postpartum depression oftentimes can occur during pregnancy, during the last trimester of pregnancy up until the 1 year postpartum. That's how long postpartum depression you are at risk for postpartum depression. And most of the time in onset 3 months, anywhere between the pregnancy up to 3 month postpartum. But like I mentioned earlier, you are still at risk of a up until the baby turns 1. All right. And the symptoms of postpartum depression. Somebody is unmuted. Is that a question? Perfect. I think we are fine now.
Yeah, if everybody could just put themselves on mute, and then you can unmute when we're ready for the question and answer piece. Thank you.
Awesome. Yeah, postpartum depression affect 1 in 7 women in during the childbearing phase, right? So if you go to your doctor's office and you see 7 women sitting um at the doctor's office, at least one of them will experience postpartum depression. That's how common it is, right? And the symptoms of postpartum depression are characterized by hopelessness, intense feeling of inadequacy, overwhelming guilt, anxiety, fatigue, crying for no apparent reason, fear of being alone, over concern, under concern, sleeping too much or not sleeping at all, overeating or not eating at all. So these symptoms can vary, right? It's not a one size fits all disorder. So one mom may experience the sadness, the hopelessness, lack of interest. And another mom might experience rage, right? She's just angry all the time for no apparent reason. Does not want to see anybody, get along with anyone, have difficulty bonding with her baby. So knowing the symptoms and realizing that, okay, this is not one size fit all. One mom may be experiencing it this way and another mom may be experiencing it that way helps when it comes to identification of the disorder. All right. Um, I have in the chat, Karen said, excessive or erratic sleep pattern, low or no energy. Yes, this interest in things that usually interest them. Yes, you hit the nail on the head. Inability to connect with the baby or family members. Yes. Yes to all of it. So those are some symptoms, those are the symptoms of postpartum depression. And we're gonna move on to postpartum anxiety or panic disorder. Postpartum anxiety, we learned a lot about postpartum anxiety during the pandemic. Okay. We do it in our program, the emotional well-being program, we have a mini program, which is the emotional well-being, emotional health and support program. And the emotional health and support program usually follow up, provide a continuum of care to mothers after they leave the hospital. And when during the pandemic, we heard a lot like this, our clients were sharing, listen, I am feeling some type of way, but I know I'm not depressed. I know I'm not depressed. I am not, crying for no apparent reason. I am not sad, but there is something wrong with me, right? And it was hard when postpartum anxiety wasn't in the forefront of the perinatal mood and anxiety disorder. So we were trying to understand what was happening at the same time as it was happening. My mom was saying like I am having difficulties breathing, and we're like, oh, go to the hospital, make sure you get screened for, you know, for different issues. Oh, I'm having a severe headache and my blood pressure is normal, but I don't know what's happening. We'll constantly send them to the hospital until we realize that they were experiencing somatic symptoms of anxiety, right? Because everybody get anxiety is different. Some, I know for me, whenever I'm anxious, I just feel the need to go to the bathroom 10 times. And that's how my anxiety shows, right? And others feel the anxiety through the chest, tightening of the chest. Some people experience headache. Some people have difficulties breathing to the point that they go to the hospital with heart attack concern, and the doctor, everybody screens them and tell them, I'm sorry, your heart look fine, everything looks good, I think you are having an anxiety. So postpartum anxiety it's paired with some intrusive thoughts, right? The thought of something terrible happening to you. um in some cases, that's why mothers sometimes stay up to see if their baby's breathing, right? Because they are anxious. If I go to sleep, my child will stop breathing, and then I won't be able to save my baby. So they stay up and they watch baby over and over to ensure that baby is breathing. That is a sign of anxiety, right? The thought of, oh, I cannot drive my baby to the doctor because if I put my baby in the car, we might crash and then my baby will die. Symptoms of postpartum anxiety. Um, those thoughts of I cannot bathe my baby alone. If I bathe my baby might slip through my hand and drown. Those are thoughts of anxiety. And I'm sure we all have intrusive thoughts. I promise you, I do. I suffer from anxiety. So these things happen to a pregnant or new mom, right? But they don't disclose it often. When it becomes concerning, when it is negatively affecting your quality of life. when you cannot function properly, or you're having difficulty sleeping because of these thoughts, or you having like a panic attack all the time, it is time to consult a professional about your anxiety symptoms. Granted, any new mom is going to be anxious, right? You give birth at the hospital, they give you this little bundle of joy and say, "Here, good luck. Make sure you keep them alive." And call us if you need anything. Anyone will be anxious. I don't know what this baby need. I don't know. I don't know how to, some people don't even know how to change a diaper, right? It's a trial and error. You're gonna make a breastfeeding add on a lot of anxiety. Am I doing it right? Is this baby eating enough? All of it is some level of anxiety is normal in parenthood, but when it started to impact your quality of life, then it's time to seek help, right? Yes, Karen, I love that. It's okay to not be okay in any stage of parenting. Yep, I do agree. I agree. Can you choose a somatic for any people that may not be familiar with the term? Yes, so somatic symptoms are like physical symptom that may mimic physical illnesses, right? So usually mood, anxiety, you are more so like it's more so mental and emotional. But when you're starting to have like physical illnesses due to your anxiety, that's what we refer to as somatic symptoms. So somatic symptoms are like the headache that I mentioned, irritable bowel, like you constantly feel the need to use the restroom. You literally feel like your chest is tightening up. You are having a heart attack when in reality you are experiencing anxiety. And when you feel the tightening on your chest, please go to the hospital, call 911, go there, let them screen you to ensure that you don't have, uh, you're not dying, right? But in that moment, it feels like you are dying, and you get screened. They screen you for everything physical, only to realize that, hey, whatever issues happening is emotional. I recently had one of my friend, uh, hospitalized because she shared that she was having a heart attack. She felt like she was having a heart attack when in reality she was having a panic disorder, a panic attack. Okay. Any other question if I continue? No? Okay, awesome. So let's move on to postpartum OCD. Postpartum OCD is postpartum obsessive compulsive disorder. Oftentimes married to anxiety, right? So what drives the obsessive act is the anxiety. So those who have postpartum OCD have intense intrusive thoughts. Real life example I can give you is that a client of mine shared that whenever her husband leaves home, she feels the need to unlock and lock her door until her husband gets back home. And the thoughts that drive that act is that someone is gonna break into their home, take her baby, and run away. So she spends majority of her day locking and unlocking the door, to the point that whenever her husband gets home, she's exhausted, she's unable to function. She hasn't like she doesn't eat when her husband is out of the house. That is very concerning. The moment she disclosed that to me, immediately we got her connected to a therapist and a psychiatrist that needed immediate help, right? So that's an example of postpartum OCD. Another example is those who are obsessed with cleaning, trying to protect the baby from germs, or if someone touches my baby will get ill and die, right? That's the intrusive thought that causes them to over clean or overly wash their hand, or getting out of the house. For example, a mom might double check their bag like 8 times before they leave the house, trying to ensure that she didn't forget anything. She didn't forget anything. But that thought causes her to be late all the time. Never, it's causing her to never leave the house out of fear that she's gonna forget the necessities. So those are some of the symptoms of postpartum OCDs. Okay. Post-traumatic stress disorders. Post-traumatic stress disorder is, we always like to say in our program that trauma is in the eye of the beholder, right? Whenever we discuss a birth experience with a mom might say that was the most traumatic birth I've ever experienced. And the doctors and nurses will be like, "Oh, the birth went well. Mommy is well, baby is well. We are grateful." But in reality, it wasn't that. It wasn't a positive birth for the mother. A recent example is a client of mine saying she got checked multiple times to see how far along she was, how far dilated she was at the hospital, which reminded her of her sexual abuse history. So she was traumatized during the birthing process, even though she had the vaginal birth that she always wanted. She had the vaginal birth. In the eye of other, it was a positive birth, but in her eye, it was a very traumatic birth. And she didn't know that she could advocate for herself, let them know of her history, so they minimize the amount of time she was checked. She didn't know that, right? This is her first birth. So she went along with the requirement only to leave that birth experience very traumatized. And now whenever she looked at her baby, she shared that the baby is a reminder of what had happened to her. She's having difficulties bonding with her baby now due to her birthing experience. So trauma is a physical or mental response to something, right? A mother may have a birth plan of vaginal, non-medicated birth, and then things went or things go left. She ended up having an emergency C-section. That mother may be traumatized, although she came out of that birth healthy and safe, right? The experience, her in her mind, she wanted a vaginal birth without medical intervention. She didn't get that. Now she's traumatized, and during her next pregnancy might elicit some of those feelings of being out of control in that moment. So post-traumatic stress disorder is in the eye of the beholder, and whenever a mom express feeling traumatized by an experience, we definitely encourage therapy, trauma-informed therapy. Okay. Perinatal bipolar disorder. Perinatal bipolar disorder is another one that I would say whenever a mom get diagnosed during the perinatal period with bipolar disorder, chances are she has always had it. Okay? Whenever a mom get diagnosed with bipolar disorder during pregnancy or after birth, chances are she has always had. The hormones are now making it more apparent. So for it to be diagnosed, okay? So we all know that bipolar disorder has two part, right? The mania and the depressive episode. So the depressive side mimic all thing postpartum depression, and the manic side comes with erratic behavior, right? A lot of worst case, some hallucination, some delusion in worst case. So whenever you experience a client, a mom, yourself, a friend in this space, medication is needed immediately. Whether it's during pregnancy or after birth, this mom needs to be on medication. Yes, Karen. Yes, this mom needs to be on medication. There are medications that are safe to take during pregnancy, and there are medications that are safe to take after birth. Do not get off medication if you get diagnosed with bipolar disorder during your pregnancy. Okay? Now, I am going to go to postpartum psychosis. Postpartum psychosis is the most severe perinatal mood and anxiety disorder out of all of them. And it is, although it is, I don't like to use the term rare, but because it does happen to 1 out of every 1,000 birth, right? So it's not as common as postpartum depression, but it does happen and it is very, very serious. When a mom goes on Google to type in, or if a mom goes on Google to type in, do I have postpartum psychosis? Chances are she doesn't have it. Postpartum psychosis causes one to be out of touch with reality. So whatever they are thinking, feeling, seeing is their reality, right? And it is the symptoms that comes to mind are that, and I've worked with a lot of mom, and I remember talking to this young mom who shared that she was hospitalized for postpartum psychosis, and her symptoms were that she was seeing things that are telling her, or people that were telling her that she was not good enough, and that she should unalive herself. Her babies will be better off without her. And thankfully, whomever she was disclosing this information to got the cops involved immediately and got her help. The person she was with dialed 911. They got there, took her to the hospital, and that's why she was able to tell us her story now. Right? So it comprises of like auditory hallucination, delusion, paranoia, disorganization, and sometimes visual hallucination. I remember going to a conference, PSI, Postpartum Support International Conference, and they had postpartum psychosis survivors there to share their story. And one of them shared that she almost unalived her baby because she heard Jesus asking her to sacrifice her baby. And she took her baby to the yard to perform the sacrifice. And thankfully, her neighbors saw her, ran into the situation, grabbed the baby, and was able to call for help. And that is why she is here today to share her story, right? That is how severe postpartum psychosis is. they are out of touch with reality. And when that happens, there is no, let me call for a therapist for you. It's immediate hospitalization. Okay. Every county in New Jersey has a PES unit, which is psychiatric evaluation screening services. You can call on them and they come to the house, they perform screening, they get mom help immediately. If you can get hold of your PES unit, call 911, right? And get that mom to the hospital ASAP. This postpartum psychosis can onset usually between 24 hours to 3 weeks after delivery, right? And you should pay attention to the mom's sleep pattern. That will give you a clear picture of what's happening, because there's some of their symptoms may cause them to stay awake and be sleep deprived, and you see the paranoia in them. So it is the most severe out of all of them, but it is treatable, right? The key here is to get that parent to the hospital as soon as possible. Okay. Also, history, one of the risk factor is bipolar disorder is a risk factor for postpartum psychosis. And then family history of psychotic illnesses is a risk factor. Sleep deprivation, medication discontinuation during the bipolar phase, right, can cause one to experience postpartum psychosis. Okay. Now, on to the next session. How am I doing on time? 12:41. Okay, right. So let me move on. I shared that the postpartum depression piece, postpartum depression in the BIPOC population. Let's touch on that briefly. Patients of color are more likely to experience BPD, and yet they are 57% less likely to seek treatment when compared to their white counterpart. More than 50% of low-income burden individuals met the criteria for depression during the first 14 months after giving birth. And Black patients in New Jersey are more than 3 times as likely as white patients to experience PPD symptoms. Patients with Medicaid are even more likely to experience postpartum depression. So the risk factors are prenatal depression history of depression in general, history of anxiety, stress, life stressors. Teen pregnancy is a risk factor, lack of social support, marital satisfaction support, social economic factors, obstetrical complication, history of trauma, difficult pregnancy/childbirth. Thank you. I touched base on the symptoms of depression earlier on. These are physical and somatic symptoms unexplained, such as headache, body ache, digestive complaints, shortness of breath, muscle ache, restlessness, and dizziness. These are all somatic symptoms of anxiety. Now, I'm just going to talk briefly about depression in dads. 9.2% of dads have depression prenatally. And many people always ask me, like, but they didn't carry the baby. Why are they depressed? It's an adjustment for everyone, right? So depression in dad is oftentimes masked due to all the question that comes with it, right? What hormone they're not experiencing this hormone or that hormone. Dads have hormones too, They have hormones too. Sleep deprivation can cause anyone to have, depression and have low mood. If I don't get sleep, I'm a zombie. I'm a zombie. I'm easily irritated. I don't want to talk to people. I have no interest in things that I enjoy due to lack of sleep. And now there is a disruption in that sleep pattern. And if mom experienced depression, dad is at a higher risk of experiencing paternal depression because there is a disruption in the union. Male depression often it looks different than female depression. Male depression comes with avoidant behavior, right? That would rather do anything and everything than be home with, his partner and the baby. He rather go to the spend time at the gym. He would rather go hang out with his friends than come home. It also come in the most severe case with violent behavior because they don't know what's happening within them emotionally or mentally. So the best way is to act it out, and it can become violent. In any case, if you experience you find yourself in that space where your partner is acting violent towards you, the goal is to remove yourself out of the house and get them help, right? Do not try to get them help in their presence if they become violent. All right. So though that's a little bit about paternal depression, so have conversation with your partner if you introduce a new baby into the picture and then you see a change in behavior. Please have a conversation, check in on them, ask how they are doing emotionally, mentally, physically, right? Ask those questions. They might be experiencing paternal depression or paternal anxiety. So why is it important to screen? Patient physical appearance is not an accurate depiction of their mental and emotional health, right? Those moms that you see put together may be the ones suffering the most. And those who look a hot mess may just, be sleep deprived, right? So you never really know. So ask the question, initiate an open and honest conversation between patient and provider, allow provider to make the appropriate referral, promote a trusting relationship between patient and provider, create a safe and comfortable space for transparency. So most people use the Edinburgh Post Depression scale, postnatal depression scale. It is a free 10-item questionnaire that was developed to screen individual during the perinatal period. The the scale is free, validated screening tool recommended by the New Jersey Department of Health. It is available in many languages and it's not always culturally consistent, but it does the job at gauging where a person is mentally and emotionally. And so how to introduce the screening, create a safe space for patients to be honest about their emotional health, assure that their overall health is your top priority. I always like to put this, please, when screening, make sure the patient can understand. And if there's a language barrier, feel free to read it to them. Even if you have the form, the scale in their language, it doesn't always translate the way it should. So make sure you read it, and uh, explain to them what they will be what they are answering. Okay. Inform patient that this is a tool used to evaluate their emotional health in the past 7 days. This is what the scale looks like. And is online. It's a free tool, screening tool. You can print one out. You can take one yourself at home. And that's what it looks like, the Edinburgh Postnatal Depression Scale. So the question asks, can you tell me how you've been feeling emotionally during your last trimester? Is there anyone who is going to be helping you at home with the baby? How often are they going to help? These are a follow-up question. How, it's been 2 weeks after you deliver, are you still feeling like that most of the time? It may be postpartum depression. You arm them with resources like New Jersey Speak Up When You're Down hotline, and you can also refer them to the partnership. So self-reporting challenges are fear of judgment, negative relationship with healthcare system, denial of illness, inaccurate self-report, ability to mask symptom, especially if highly functional. What happened in this house stays in this house mindset, and diagnose mood disorder, involvement of protection agency. And let me stress the importance of this. Please, if you come across a mother who's struggling, your first instinct shouldn't be, let me threaten them with the CPNP. Your first instinct should be, let me help you. Okay, how can I help you? Is there anyone who can watch the baby while we get you treated, especially for those who may be experiencing bipolar disorder and so forth? Is there anyone you trust that can watch your baby right now, right? That should be your first instincts. And of course, if Child Protective Agency needs to be involved, that is okay too, right? But make sure that you are reporting accurately to the Child Protective Agency so they can also help that mom. DCPNP has a wealth of resources for treatment, therapy, parenting classes. It can only help the mom, but you have to accurately report it. Health insurance, financial and childcare and security are some of the self-reporting challenges. I don't have anyone to watch my baby. How can I go to therapy? But thank God for telehealth now, right? So those are speaking about emotion, open-ended question you can ask a new mom or ask yourself, can you describe to me how you've been feeling emotionally? Like sometimes you have to check in with yourself too as a mom and ask, how am I feeling emotionally? Right? And be open and honest with yourself. I haven't been doing well, and that's okay. Write that down. But if you are in the care of mothers, you can ask, describe to me how you've been feeling emotionally. Who is a part of your support system? How do you make use of your support team? How many hours of uninterrupted sleep are you getting? How have you been coping with sleep deprivation? Is there an aspect of parenthood that you really enjoy? What aspect of parenthood do you find to be the most challenging? And then reinforcing messages that we oftentimes use is being a parent is a hard job. No matter how bad you may be feeling, once you get the level of care you need, you'll start to feel better. PPD doesn't last forever and is 100% treatable. Sadness is a very common experience during pregnancy and after birth. It is important for you to know that you don't have to suffer in silence. There is help. Being depressed doesn't mean you are a bad parent. What you are experiencing is in fact real and not just in your head. You are not alone. Okay, these are all reinforcing messages that we like to share with our mom. So I can go on and on, right? I'm gonna stop right here. I'm gonna
Oh, and we wish we had more time for you to do that. And
right.
what I do want to say is, first of all, thank you so much for this incredible presentation. You presented so much information, and I did put it in the chat that if we had a part two, and in my head, I'm thinking a part two is you're working with somebody that you feel is showing some signs of perinatal depression or anxiety. What do you do? you know, so I mean, I think a part two would be like, how can we support
Support.
moms, dads, the family unit, and what's available out there? I mean, that's
Mhm.
just an idea for a fall, but if anybody has any ideas for follow-up, you know, please do. But does anyone have any questions that they want to ask of Lorraine? Well, we have a few more minutes. I didn't see anything in the chat that wasn't answered. But I mean, for me, it is like, I know that you work for the partnership
Yeah.
in Northern Jersey and that they provide support groups and services. Is this something that's provided in all of the consortiums across the state? Or
Yes, so we have our sister consortia in Central and in South Jersey. We pretty much have the same program. But unfortunately, comes June 28th, the fate of that program is in jeopardy. So we don't really know what that is going to look like moving forward. But yes, the program will be sunsetting when it comes to
this year or June of 2028?
no,
June
no, no, no.
28.
States of this year, right, right.
Wait, call me after with, you know,
Right. So it's more so they calling it a facelift, a facelift. So we don't know what that looks like. But we are here to provide support in finding resources to support the mothers that you do and your clients that you do care for.
I'm going to stop recording now in case anyone has any questions.